Hey, good morning. Do you know that the color of that vaginal discharge can actually tell you what type of vaginal infection you have? Okay, first, a thick whitish discharge can actually be an indication that that vaginal discharge is candidiasis. Candidiasis is characterized by a thick whitish vaginal discharge, and it may also come with fever and also vaginal itching. 2. A brownish vaginal discharge is an indication that this is actually an old blood. A greenish vaginal discharge can be an indication that this vaginal discharge is actually bacterial vaginosis or trichomoniasis. Now, what is bacterial vaginosis or trichomoniasis? It's actually a type of vaginal infection that is characterized by a greenish yellow vaginal discharge that comes with a fishy odor or a fishy smell. So if you notice this, it means that it's likely to be trichomoniasis or bacterial vaginosis. So if you see a brownish vaginal discharge, it can actually be normal, because a brownish vaginal discharge is an indication that an old blood is just passing out. Why this description is important for you is that not all vaginal discharges are caused by bacteria, so you don't necessarily need antibiotics for all vaginal discharge, and that is why we always advise and advocate that when you have a vaginal infection, you don't go to the pharmacy, you see a doctor, because only a doctor can diagnose you and tell you that this vaginal discharge is caused by bacteria or viruses. And this is one of the reasons why many of you actually abuse antibiotics. You use antibiotics for vaginal infections that are not caused by bacteria, and then end up developing what we refer to as antibiotic resistance. Lastly, it is important for you to know that bacterial vaginosis and vaginal candidiasis are not sexually transmitted. They're actually gotten from other practices like douching. And when we say douching, we mean washing inside the vagina. And 2, it may also be due to the use of medicated soaps. And apart from medicated soaps and douching, it can also be caused by practices like washing your vagina, washing your anus after defecating from back to front. It can transfer the abnormal bacteria from the back into the vagina, predisposing you to an infection. So, and finally, the use of tight underwears or nylon pants can also predispose you. So we prefer you actually use cotton materials.